Welcome back. We are joined by Dr. Timothy Jochen from Contour Dermatology and Cosmetic Surgery Center. Actually, I should call you assistant professor. Congratulations on the promotion at USC. You were actually a professor over there teaching people how to be just like you, right?
Yes, exactly. Well, it's been 15 years now, so I got the promotion.
Well, time well served, right?
Yes.
Anyway, congratulations and thanks for joining us today. You're going to talk about a topic that is pretty, well, I'd say it's pretty common, but I wouldn't have thought to go to you to get it fixed.
Well, you know, underneath the chin, there's a statistic that says that bothers people as much as crow's feet. So it's kind of interesting.
Really? Is this part of an aging process, though, right? That people, is everyone going to get a saggy chin?
Well, there's two things we're talking about. We're talking about the double chin from fat, and then there's a saggy chin from getting older. So, you know, double chins are a little bit different. Ultimately, we'll all get a saggy chin. I mean, unless you're really blessed genetically. But, you know, this is something you can get as early as your childhood years.
Really?
So,
yes. What, just it's fat that
it's just
deposits
fat cells underneath the chin. And, you know, in the past, the main treatment option that we had was to do liposuction. But now they have a new product called Kybella, which actually helps to destroy those fat cells so they just get eliminated from our bodies.
So how does that work? When you say it just gets eliminated, how does it just absorbs into your endocrine system or what?
Well, it gets absorbed into our system and it's eliminated through things like waste, you know, so that's really the main way we eliminate it from our bodies.
Does it actually melt the fat inside your body? How does it work? I mean, explain how it actually works.
What it does is it actually is injected. It's deoxycholate, which is in our bodies and helps us to break down fat cells. And so what this does is it destroys the fat cell wall, and then it makes it so the fat cell can't absorb any nutrients, and so the fat cell just gets flushed out of our body.
How weird. It seems very science fiction to me. But are there side effects from this?
You know, the side effects are really minimal. It's really more side effects from the injection itself. So if you poke your skin with a needle, what can happen? You can get bruising or swelling. And so that's really what you can see with this treatment. There are no really serious side effects at all. There may be a little bit of tenderness as well, but again, if you just poke your skin with a needle, you can get tenderness. And so it's a real breakthrough.
Okay, now I think we're going to look at some pictures of before and after, the effects of, I don't know that you can see it looking over on the screen, but wow, that is all right, now we're looking at a much larger deposit of, and now that is pretty amazing because the thought of having, you know, with liposuction, the thought of somebody really digging around in your neck could have been really bothersome to a lot of people. And this is, how long does it take for it to take effect?
Usually people start to see a result within 1 to 2 months. And we do these treatments at 1 month intervals, and you'll do up to 6 treatments. So most people need two to 6 treatments with this type of therapy.
Can it be used in other parts of the body?
Well, you know, initially this was called mesotherapy, and what it was sort of an unscientific process that we were doing when I first started out about 15 years ago. But what they've done is they've calibrated this medication called deoxycholate to make it more precise. So we know exactly how much to use for this area. I think over time we'll start to use it in other areas, but right now it's only been studied for underneath the chin. So and that's a very extensive process to get through the FDA to get clearance for something. So as this becomes successful, we'll probably see it being used for other areas.
Because I had other, you know, areas that I was thinking.
Yes.
All right. Thank you so much, Doctor. It was so nice having you here. And if you would like more information and to be interested, contact Dr. Timothy Jochen at Contour Dermatology.